My name is Dr. Anthony Yoon and I'm known as America's Holistic Plastic Surgeon. On this video, we're going to react to an episode of Botched. Now, as a holistic plastic surgeon, I'm all about integrative medicine, combining East and West when it comes down to the ideal in healthcare and medicine today. But there are certain things that are deemed holistic that I do not agree with, and we're going to tackle that as well as messed up noses on this video today. Let's watch.
My name is Kelly, and after removing my own skin cancer, I am left with a bulbous red nose.
Did she say she removed her own skin cancer? That is not something that you should do. Cancer is one thing that you do not mess with. If you've got cancer, you don't want to treat that yourself. You really want to see an actual doctor. And I'm curious to see, how did she treat her own cancer?
I was diagnosed with skin cancer. They wanted to do a surgery. I decided to see if there was an alternative, and it was called black salve.
Black salve?
Black salve is a homeopathic remedy that I call not black salve, but black death. Black salve basically is a paste that is compounded, or you can buy it overseas, and it's basically a fake cure for cancer. And so people put this caustic paste, which can be composed of many different substances depending on who makes it, and it's caustic because it's like acid that will destroy your tissues and leave what's called an eschar. An eschar is a black patch of dead tissue. So some people call black salve an escharotic. This is not something that you want to mess around with, and I am not somebody who would recommend black salve for anything. So let's see what happens when she applies it to her nose. I mean, I'll tell you, that's f***ed up.
Black salve is a homeopathic treatment for curing cancers. I did the whole tip of my nose. Then I also put some on my forehead as well, because I had a spot up there too.
Oh! This is so freaking scary. This is a paste that can destroy your tissues. Now, I know there are stories out there of people who are using black salve to take off, let's say, skin tags, very superficial even skin cancers, and some people have not had horrible reactions like this to it. But the problem with black salve, it's not like a medication that you can buy at your drugstore that is a very specific concentration. Is it possible that very dilute black salve isn't as dangerous as really concentrated? Well, possible, I guess, but you shouldn't apply it at all. I'm all for holistic, integrative approaches to cancer, combining Western medicine, which we know treats cancer, like removing it surgically, with Eastern types of options and more holistic options with optimizing your health, eating the right foods, exercising, and so many other things that you can do to support your immune system. But you don't want to necessarily just rely on something that is unproven, and in her case, extremely dangerous, and ignore medical advice.
I went to bed and wake up the next morning, and I mean, already my face had started to swell. And it got black. It had gone all the way down into the nasal passages, took the entire tip.
This is a nightmare. That black salve apparently ate away and destroyed her native tissues. And by taking out that much of her nose, my guess is they ended up doing a forehead flap on her, where you actually take skin from the forehead, flip it down to provide coverage over the nose. What she needed in this situation is a major reconstruction.
So we had to take cartilage from behind my ear, rib cartilage, reconstruct a framework, then take this skin from my forehead, attach it to the end of the newly formed nose.
You're probably watching this and saying, oh my God, this is craziness. Why are they using forehead skin? So the issue that she has is that she is missing tissue at the tip of her nose. And that tissue is a combination of soft tissue, meaning skin with the underlying fatty component, as well as cartilage to provide the support. If all you do is put skin and fat over the nose, then the nose is going to flatten because it doesn't have the support of the cartilage. So typically you have to take cartilage from, let's say, the back of the ear or even from the ribs, use that to create a framework, and then put the soft tissue, meaning the skin with the fat, over that area. And there's also inner lining that is important as well. Well, one area that works actually pretty well for reconstructing the nose for something like this is, like I mentioned earlier, the forehead. So we take actually and draw how the nose would look on the forehead, upside down essentially, and then flip that tissue down to the nose. Now, this is not what we call a free flap, where you take it off and then reattach it and attach the blood vessels. This is what we call a pedicled flap, where it is still connected to the blood supply of the forehead. You then suture that into place to recreate the nose, suture the forehead closed, and you let it basically heal for many, many weeks. And as it's healing in place, you're developing new blood supply to the nose, and eventually then you actually will cut that bridge from the forehead to the nose and get rid of it. Now, while you have that forehead flap in place, you look really, really weird, and people typically don't leave the house. The ones who do get a lot of people stare at them.
And my nose, it doesn't exactly look the way I was hoping.
What I have to do is I have to deconstruct everything and try to rebuild it, and that's what I'm really good at. So it's a big surgery.
I'm in.
What appears to have happened for her is that the tissue from the forehead has now been moved down to her nose. That tissue may have excessive fat compared to what the surrounding nose tissue has, and that's causing what we call a bulbous or an extra full tip. So what usually is done is you cut around the area of the scar where it was sutured in place, you partially lift that tissue up, and you remove fat from the undersurface.
So obviously the normal anatomy is gone, which is like a big hole. This is treacherous. I don't think I've ever seen anything eat through skin and cartilage like this black salve. It's just like in the movies when you have this big vat of acid and then you put a body part into it and then it just dissolves. Great job, great job. This matches our computer morphing.
These are the types of operations that get surgeons really nervous because we don't have control over how the body reacts. And so by removing fat from the undersurface of that skin, of that flap, you only know that you've done too much when it's too late.
Couldn't be happier with my results. I think my nose looks so uniform. I breathe so much better. It's beautiful. Life is good. I mean, look at this profile. Do you see that? Come on.
She has an outstanding result from her operation that Dr. Nassif performed. I'm all for an integrative approach to medicine, which I believe is the best approach to medicine altogether. But when you're dealing with cancer, when you're dealing with something that potentially is life-threatening and it's an acute illness, you really want to rely on evidence-based medicine. And by all means, feel free to have a team, an integrative team of experts from all different fields to work with you. But that type of treatment really has to start with more of this traditional medicine like your oncologist. It's a lot of fun to watch plastic surgery on TV, so take a look at this video right up here where I react to an episode of Botched and a patient who wants 1,000 cc implants. How realistic is that? Find out right here.